Hi, I'm Doctor Marisa Weiss. I'm president and founder of breastcancer.org. I'm also a practicing oncologist and mom, and also a breast cancer survivor. So I'm happy to share information with you today that could help protect your life against breast cancer. After being diagnosed with breast cancer, so much of the emphasis is on the actual treatment, the mastectomies or lobectomies and re-excisions, radiation, chemotherapy, hormonal therapy, and you kind of make your way through all that. But what women may not know is that after their initial treatment's over and the rest of their life begins, they still have an everyday opportunity to reduce the risk of ever seeing a recurrence or a new breast cancer. So for example, many women are prescribed a medicine, a hormonal therapy that's taken once a day for 5 to 10 years after her initial treatment is over. And that's very important treatment that can give you some of the greatest benefits. But as human beings, we're not perfect. Once we're out a few years from our diagnosis, a lot of women stop doing what they really should be doing. So sticking with your plan, keeping up with your medicines is really important. And if there's a side effect of those medicines that's kind of getting in your way and keeping you from taking the medicine, talk to your doctor about it, because you may be able to manage that side effect or switch to another medicine that is less likely to have that side effect. It's also true that what you eat, what you drink, what you take in your everyday life can also help you reduce your risk. So eating healthy, mostly fruits and vegetables, buying organic sources of the foods that are most likely to have pesticides in them. Look at the Dirty Dozen list by the Environmental Working Group, for example. You want to make sure to exercise regularly, 3 to 4 hours a week, but 5 to 7 hours is better. For me, I love Zumba. It combines music and dance. It helps me stick to my plan as a breast cancer survivor myself. Getting to and sticking to a healthy weight is really important. That means eating less, eating small meals, limiting your alcohol use to 5 or fewer drinks per week. I try to stick to 2 to 3 types of beverages or fewer per week. These are just examples of the everyday choices that you can and really should make in order to stay as healthy as you can be moving forward after your initial treatment's over. I also have a book called Living Well Beyond Breast Cancer that I wrote with my mother, who's a survivor. And it's a Bible, really, for how to manage the everyday choices and hurdles in your life. And then at breastcancer.org, we have many places where you can go, including the discussion boards, to get expert medical information as well as personal experience that can help guide your way through and beyond breast cancer.